Hello, this is Dr. Patrick Nemechek, and I want to share with you a study I presented at the 13th International Neuromodulation Congress in Edinburgh, Scotland. Topic is the reversal of post-traumatic stress disorder with transcutaneous vagus nerve stimulation in combination with an anti-inflammatory regimen. We now know the human brain is quite capable of recovery for injury. The damage can be traumatic, emotional, inflammatory insults. This would be such as surgeries, fractures, maybe even vaccines, toxic exposures. And what happens here is you have, as the neuron in your brain gets damaged, it's detected by what is called the surveillance microglia. It first morphs into a pro-inflammatory phenotype, which cleans up some of the debris, and then later morphs into a M2 anti-inflammatory reparative microglia. This, in conjunction with neurotropins and the production of neuroprogenitor stem cells, leads to the repair of neurons. With your common concussion, the repair of neurons that are affected by that will occur within 2 weeks to 3 months. But unfortunately, recovery is quite inconsistent. It can often lead to autonomic dysfunction, which results in low blood pressure and oxygen delivery to the head and neck, resulting in headaches, neck pain, anxiety, poor cognition, altered balance, and fatigue. It can also damage a part of the brain known as the hippocampus. This is where we house our emotional center. And this can result in chronic depression and post-traumatic stress disorder. The impaired recovery process seems to be most adversely affected by an excess number of what are called primed microglia and the excessive production of pro-inflammatory cytokines. These cytokines, which are white chemicals coming out of the white blood cells, are released through LPS bacterial translocation in the gut, also known as leaky gut, the priming of M1 microglia, and as well as excessive dietary intake of linoleic and palmitic acids. The M1 microglia are being formed by the bacterial translocation itself, as well as maybe repeat brain traumas that you might find in, say, professional football, an imbalance of omega-3 and 6 fatty acids, and diesel fumes. So here you can see the M0 microglia goes through this permanent priming phase. This is permanent. This is an inflammatory white blood cell, this microglia, that is continually producing these pro-inflammatory cytokines. These are added to, as I mentioned, by the linoleic acid and the other sources in the periphery like leaky gut. Combined together with each additional injury, these chemicals lead to the magnification of the damage and impair the repair process, leading to worse recovery. You get more damage, less recovery with each injury, and that's what we see in studies. For emotional traumas in particular, an increased emotional event will lead to increased apoptosis. This is a increased cellular death within the brain. We have then also decreased production of neurons to replace the ones that are damaged, and then you leave a number that are permanently damaged, but still surviving. It seems to particularly affect the hippocampus. Again, that is the area of the brain where you house your emotions, and we can see on a variety of scanning studies that the volume of the hippocampus in the brain, it tends to be reduced in patients with chronic depression as well as post-traumatic stress disorder. And there are also studies now linking the elevation of these inflammatory cytokines with PTSD in particular. We have studies looking at soldiers that levels of inflammation as measured by the CRP and interleukin-6 levels in the bloodstream when measured before deployment are predictive of the development of chronic PTSD after deployment. So essentially, you can measure the blood test of a Marine before they go to Afghanistan, and you can predict who will probably come back with chronic PTSD. Also, low heart rate variability is a measure of post-deployment PTSD. Low heart rate variability, this is a measure of autonomic function correlates quite well with inflammatory stress in the brain, so it is actually another inflammatory marker. My premise of the study was that the excessive pro-inflammatory cytokines were inhibiting normal neuronal repair mechanisms, and that suppression of these cytokines would reactivate neuronal repair processes, repair brain injury responsible for PTSD and autonomic dysfunction. We developed what's called the Nemechek protocol, and it addresses a variety of inflammatory problems simultaneously in the brain. It addresses the production of cytokines through bacterial translocation, white blood cells, the linoleic palmitic acids in the diet, this 3,6 fatty acid imbalance, and other sources of cytokines. It also helps with microglia, stem cell, and neurotrophin dysfunction and dysregulation. And you can see here it involves, again, this is our original thing, but we use a short course of rifaximin. It's a non-absorbable antibiotic to help rebalance intestinal bacteria. That will lessen further priming of white blood cells into the microglia format, and also reduces pro-inflammatory cytokines that are being produced at the level of the gut. Transcutaneous vagus nerve stimulation, DHA from fish oil, and curcumin all are known to prevent the production of cytokines from the M1 microglia by namely shifting the M1 microglia into an M2 phenotype. And surprisingly, olive oil contains 70% oleic acid. This is a omega-9 fatty acid, and will actually completely block the effects of dietary linoleic and palmitic acids. Collectively, you have a large reduction of these pro-inflammatory cytokines, and we no longer have the increased damage of the brain with each trauma, but we also have a restoration of the repair process, leading to symptomatic and autonomic recovery. So this is a retrospective analysis of two subjects. One is a 78-year-old male, the other a 36-year-old male. Subject one had been a Marine in the Korean War, and for 60 years since, he had been having violent war-related nightmares, severe depression, and several bouts of alcoholism. Subject two was a mechanic in the U.S. Army in Afghanistan, and for 11 years he experienced frequent fits of rage and anger several times a week. These episodes were so intense that they often resulted in the destruction of property, with subsequent job loss and a significant disruption in the functioning of his family. The protocol consists of transcutaneous vagus nerve stimulation, rifaximin, as I mentioned, a high dose of fatty acids with a predominant 2-to-1 ratio of DHA to EPA, 30 mLs of olive oil, ALA in the form of nuts or flax, and then monthly spectral analysis, which allows us to modify the protocol as we go along. The spectral analysis is provided through a device called the ANX 3.0 produced by Ansar. It's a very nice device, gives us both frequency and time domain data, but most importantly, the parasympathetic and sympathetic frequency analyses are normalized for the rate of breathing. Respirations can greatly influence these. Unless you control that tightly, you'll get some aberrant readings. And it's a very simple device to use. You don't need any specialized technicians. And in 17 minutes, we get a 5-minute seated, a 1-minute pace breathing, a Valsalva challenge, and a 5-minute orthostatic challenge. So in subject one, this is the gentleman who fought in the Korean War. He starts his regimen. He's not on any psychotropic meds. I should add, both these gentlemen have been evaluated by both the VA and outside psychiatrists and have been diagnosed with PTSD. Within 6 months, his flashbacks are reduced from about 1 a week to 1 a month. Depression is lessening. Some of his autonomic symptoms, such as lightheadedness, nocturia, and headaches, have resolved. At 8 months, his PTSD symptoms have completely stopped after 60 years. Over the next 2.5 years, the patient remains in remission on maintenance of vagostimulation, DHA, and olive oil. And here you can see improvement of his autonomic function. In particular, it's the suppression of the parasympathetics here at resting. This is called low heart rate variability. And you can see here within 8 months, he has normalization of that. Again, Low parasympathetic function and heart rate variability in particular are markers of intracranial inflammation. Subject 2 was on the same regimen, and within 2 months, he had already had some marked improvement in autonomic function, with cognition, energy, and headaches, thirst, and nocturia all greatly improving. And at 5 months, his fits of rage and depression completely disappeared after 11 years. He too, we can see the suppressed parasympathetic functioning here, and this imbalance is showing up here as what we call sympathetic dominance. And within just 5 months, we have normalization of both sympathetic parasympathetic modulation as well as improved sympathetic balance. In conclusion, chronic PTSD the associated autonomic dysfunction are reversible with transcutaneous nerve stimulation as part of the Nemechek protocol for autonomic recovery. These case reports presently support our thesis that chronic PTSD is due to the failure of the brain's injury repair mechanisms, and that normalization of pro-inflammatory cytokine levels and microglia function restore brain function. We presently have about a half a dozen other cases in the process of treatment, and we'll be updating this data set. Future considerations is that the simplicity of this regimen can greatly enhance the military readiness of personnel while in the theater of combat and even during training. The use of small portable transcutaneous vagus nerve devices, changes in cooking oils used in food preparation of troops, and daily supplement packets of fish oil would allow soldiers to recover more quickly from the physical and emotional traumas capable of causing their brain injury. Thank you.